Hello, welcome to today's Insta Live. For those of you who don't know me, my name is Andrea Trigo. I am the founder of Enhanced Fertility. And today I would like to introduce you to an amazing new clinic, Vida Fertility. I'm going to bring Dr. Natalia from Vida Fertility to this Insta Live with me because I want to let you know all about this clinic that has an approach to fertility care. And let's see if I can bring Dr. Natalia. Hello, Dr. Natalia.
Hello, how are you?
Thank you so much for joining us today.
Thank you so much for inviting me. Can you see me?
Yes, I can see you and I
Perfect,
can hear you.
perfect.
Dr. Natalia, I wanted to introduce Vida Fertility to our community because it's a brand new clinic. I know it's something that comes from your heart and your passion. So maybe let's start there. What is Vida Fertility and how did it start?
Vida Fertility, it's a project that we started together a couple of months ago. Actually, during the COVID pandemic times, everybody had different jobs, and because there were no international patients, a lot of us, we were just struggling. We had work in a hospital, operating theaters, and then the colleagues that I have known more than 10 years here in Spain who used to work with me in different clinics, they came and they said, why don't we do something together? And this is how life is. That's why we decided to call it Vida Fertility, because we know that during hard times, you see who is your friend and who is your enemy, and all best friends came together, make Vida Fertility happen. I was very lucky, I was very fortunate, because a couple of years ago I bought commercial property and I was not sure what to do with this. And the only project that City Hall allowed me for was a clinic. So the clinic was almost done when the team came, and we are ready to go.
So that name Vida means life.
Yeah, life, which we want to give for our patients here in Playa de Mucha Vista. Playa Mucha Vista in Spanish means a lot of view, big view. The clinic with big view, which is ready to give lives, new lives to new babies, to new embryos, for new patients.
That sounds amazing. And so it is based in Spain, isn't it?
The clinic is based in Alicante area. We are 20 minutes drive from the airport. The place that we picked for the clinic is quiet, because you can imagine the Playa San Juan or the Alicante beach are very crowded during summer. So Playa de Mucha Vista is in Campello. It's in suburbs of Alicante, so it's not that crowded. It has an amazing view. The clinic is at the seaside, and thanks God, it's not as famous as Alicante, but in my opinion, it's a lot more beautiful and cozy and familiar.
And Dr. Natalia, you are so experienced. You have been treating patients with fertility problems for so long.
Yeah.
And in your new website, you say there a new approach. Can you tell us a bit about this approach that you are using at Vida Fertility?
We can imagine that there's a lot of clinics that compete they are becoming big chains, and patient is just a number. You're coming to the doctor and doctor has 10-15 minutes for you. For us, this personal approach that we lost in the couple of last years is very important. So what we did was we designed an operating theater where there are 4 beautiful waiting areas for patients with the sea view, with bathrooms. So after a treatment, you can enjoy your massage, you can enjoy your Reiki, your acupuncture, whatever you wish. We give you all the time in the world to relax. So for us, this personal approach is very important. On the other side, the very modern lab that we have is there for you to give you as high as possible pregnancy rates. And thinking out of box means I was very fortunate to have a German School of Medicine, an American subspecialty in reproductive medicine. So we worked very evidence-based. For us, it's very important the proper selection of embryos. We are clinic specialized in difficult cases. I just had patients with polycystic kidney disease for genetical testing of their embryos, and if this doesn't work, of course, we are clinic specialized in egg donation and immunology. So we want to combine this modern approach with this old-fashioned saying, we want you to feel like a part of a family and feel like at home with us.
It's the best of both worlds, having the high tech, the most advanced treatments, but still being treated like a family and being treated as a patient, as a person, and
Exactly.
not in a very busy environment where you almost feel like you're being rushed.
Exactly. And I'm the only doctor now here in Alicante. We have doctors in Madrid. There will be somebody else, international doctor, that we are reviewing now, and a lot of CVs and job interviews. There will be somebody else coming to the clinic in Alicante. The objective is not to lose the focus, and the focus is happy patients with high success rates, time to pregnancy as short as possible. You can only do it when doctor itself annually has 400 or 500 patients, not more. In clinics where people see 2,000 cycles, 2,000 patients a year, this personal approach is not doable. So the goal of the clinic will be with 2-3 doctors, not to see more than 1,000 cases in Alicante and probably 1,000 cases in Madrid.
And are patients coming from the UK, from other places in Europe? Where are your patients coming from?
It's a very good question. So you can imagine that in old clinic, I had 20 international flights every year to see patients in Germany, in Zurich, in London, in Amsterdam. So because of COVID, the patient consultations in their home cities were not possible anymore. So we see patients online. We have partners like you that recommend us, and patients are coming from all over the Europe now. The PAs, the personal assistant that we have, speak German, speak English, Spanish, Italian, French fluently. So for us, the communication with in the mother tongue of patients is very, very important. So the more assistants you have that can translate you to different languages, the more patients you have. Me, myself, I see patients in German, English, Spanish. Recently, I started seeing patients in Polish. I was very surprised because of the political situation. Of course, Russian. This is where our patients are from.
And Dr. Natalia, I know you have an event coming up. Would that be a very good way of approaching and getting the journey started with Vida Fertility?
Sure. I always liked London patients, UK patients a lot because I could communicate with them in the mother tongue. And it's not only about communication, it's also about the similar sense of humor that you guys have with American people. I think that you're even better. I would like to fly to England once a month for patient meetings, as I used to. As now, being the only doctor, it will not be doable. I'll be flying every 2 months to London. We have great doctors in London that we worked with. Before COVID time, we rented an office on Harley Street. We'll be moving and we will be working with the gynecological office near Harrods in the city center of London. And in March 2022, we will be there. I don't believe it because it's my first time that I will be in London after pandemics. Brexit is not going to, break anything between us. We are going to show that medicine has no borders, and I'll be very happy to meet our new patients in London in March, and I'll do my best to discuss in person your case and find solution as soon as possible.
And what kind of treatments are people looking for when they get to Vida Fertility?
It's a very good question, Andrea. People are tired of repeating the same treatments in their countries. They want to know why they are not getting pregnant. So the most common cause is quality of eggs that is getting down due to our age, and for these patients we recommend cycles with PGDA, with genetical testing of their embryos, to show them if they are doable to generate healthy genetical normal embryos. There are some people that generate amazing embryos but have endometrial issues with implantation window issues or with immunology problems. So this is the other kind of treatments that we will be hoping to see our patients in Vida Fertility. And for everyone who has an advanced maternal age and tried everything, we are offering egg donation.
So like you mentioned, it's a lot of complex problems that people are presenting with, and some people might even have had already either inseminations or even IVF without understanding what is at the root of those failed cycles as well. So a lot of complex patients may get this opportunity of meeting you in London and getting the journey started and having a completely different approach to their treatment.
Yeah, this is something that differentiates European approach from the American school that I was lucky to attend. In the United States, the majority cycles undergo genetical testing because we doctors, we are afraid of lawsuits, that we cannot allow ourselves professionally to transfer genetically abnormal embryo and then not be able, to work because of this kind of mistake. So this is the main reason why embryos do not implant. In order to do PGDA, you have to have a very good lab director who is able to perform this kind of biopsies of embryos. You have to have a very special, expensive equipment, not only to microinject the eggs, to fertilize eggs, but also a special laser to perform trophobtoderm biopsy. So there is not many people in Europe who know how to perform this kind of biopsies and financially are capable of buying this kind of equipment. So all this we will be offering in Vida Fertility Institute.
So you have an amazing team with you, very experienced team between the people who can, the coordinators who can speak many languages, the doctors, the nurses, the embryologists. So it's like you have everything in place to provide great care to these patients that have been trying for so long and haven't been able to.
We do. The problem was when we started building this place, I was wondering, where do I find these skilled people from? And then, you know, COVID, which was a shock for everybody, brought all the solutions because a lot of professionals lost their jobs. They were looking for a new opportunity, and you know, this reproductive medicine world is quite small. So all good friends, all the best professionals that I used to know came back, and yeah, we are ready for a new project.
And so if patients go to this event in London and they want to go ahead with treatment, what would the next steps look like? Do they need to have a lot of time off to go to Spain, or can they do some of the treatment in the UK? How does it work?
So on the day of first appointment, we go through your medical history, and then we see what you need. We make a medication plan for you. We design a schedule for when you take medication, when you put injections. The first part of your cycle could be done in England, and the following week can be done here in Spain, where basically you will be prepared for egg collection, fertilization with your partner's sperm, and then you're gonna stay here 5 days for a transfer. So the schedule is usually set up this way that you are 7-8 days in Spain, either for egg donation or for working with your own eggs.
Okay, so it's not too long, and they can enjoy the beautiful views like you were saying in the beginning, and treat it a bit like a 1 week holiday.
Exactly. So the goal of 2 clinics was Madrid one for busy people, kind of hop in, hop off. When you have a very busy schedule, that you are coming for as short a stay as possible, and that the purpose of a clinic in Alicante and Campello area was to give you as much positive energy. The clinic looks like a small spa where you can relax and forget the whole world, have your vacation, and we will do our best to give you the answer why you're not getting pregnant, what can we do better, and what will be the solution for you to be a happy mom.
And I imagine that one of the biggest advantages has to do with the fact that there's no waiting list as well, because there can be a bit of a waiting list here in the UK. So to have treatment there, they can have treatment without waiting too long.
We try not to have a waiting list. Means on the day of a first appointment, we design a schedule for you, so we keep you entertained. We from the day that we see you, we set up your medication plan. We tell you which results are necessary to start working with you as soon as possible. You can imagine that during the COVID time, I had to work in a hospital here in the city center of Alicante, and it was this very like organized approach of mine. I see you once, and then everything is clear. One of the medical directors came to me and he said, "Can you explain your miracle, Natalia? You're a foreigner. Your Spanish is like your fifth language. It's not the best, but you started here with 10 patients, and now during 3 months you have 50." So this is something that is unique about the approach of Vida Fertility, that we want to give you as much information as possible about your case, seeing your results and planning on the first appointment everything that you need, so you not have a feeling, oh my God, we could have done this, to what we have missed, we could have done that. That there's no doubts. This is the objective of our work.
And when we combine the high tech and the amazing professionals and this holistic approach, I imagine that the success rates are going to be pretty good as well.
So you can imagine that we, with this team, waiting for the inspection and changing filters, and the machines with positive pressure had to be set up in a different way that we thought. We already had 3 cases, and all of them had positive pregnancy tests. So it was for us unbelievable that having this new lab, but old people working on it, the same good old people.
Yes.
We were able to show that, we can do it.
Yeah, so it works, isn't it?
It does. It does. Even though everything here around is new, brand new, we are the same old good team working on our patients. It's like hands-on training for us in a different environment. And the lab director, I think that she made her biggest dream come true. She ordered one of the best lasers for PGDA. So yeah, it does work.
Dr. Natalia, I think I want to share more about your team and your clinic to patients, because I think everyone will be very curious to see the behind the scenes. I'm going to leave this video on our Instagram feed on IGTV, and I'm going to share the link to the event you have in March, so that you can learn more about Vida Fertility. And I will get in touch, because I want to share more videos of that amazing lab and of those facilities, because I think it's something that patients are really looking for, to having a place where they know their precious eggs, sperm, embryo is really being taken care of.
I think, Andrea, I own you 3 videos more.
Yes.
One we should do in the operating theater.
Yes.
I'll be glad to do it with you, because for me, operating theater is like my home. When I was a little girl, my mom was a professor of gynecology, and she used to take me to operating theater because she had nobody to live me with. So I feel like, like being a small kid again in the operating theater. The lab, I will let you, our queen of the lab, to show you around. And then the 3rd video, probably all of us, all the team, will show you the views, the patio, the beach, where you can combine the technology with the holistic approach.
That sounds amazing, Dr. Natalia. I will look forward to sharing those videos. Thank you so much,
Andrea. Thank you for getting back to us, and I hope for a fruitful collaboration. And in March, I hope to see you too in London.
Yeah, absolutely.
Take care.
Have a good
one. You too. Bye, honey.